They looked at obesity to see if it's truly a risk factor for renal cell carcinoma, and it was found to be. And then is it a risk factor for fatal renal cell carcinoma? And so the interesting thing, and there has been controversy about this in prior studies where obesity in the form of body mass index, or what's called BMI, was not necessarily found to be a risk factor for that. But what they did is they had longitudinal data over time of what their BMI was over years, and so they averaged that out so they could get a sense of what their obesity risk or BMI was sort of over time, which gives them a good idea of longitudinally what the risk is for renal cell carcinoma. And what they found was that it was associated, the average BMI was associated with not just renal cell carcinoma, but also fatal renal cell carcinoma. And so that's important because, one, as our country is dealing with an obesity epidemic and dealing with patients advancing age, it's important to understand what really is that risk for kidney cancer and trying to hit prevention earlier.